Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing hot healthcare topics. Today, I'm joined by two guests from NMC's Rehabilitation Services Department, physical therapist Wendy Lawrence and Amy Centabar. We'll be discussing an important topic that sometimes people really are reluctant to talk about, and that is urinary incontinence. So thank you both for joining me today to talk about this topic that is, we just don't want to talk about. So I understand that there's about 14 million people in the United States that's affected by urinary incontinence or loss of bladder control. So can you give me some examples of what this represents for that urinary incontinence?
Absolutely. So loss of bladder control can present itself in many different ways. It might be losing a few drops of urine when you exercise or run. It might be a complete loss of urine when you're sneezing or coughing. It might mean that you're leaking at night. And sometimes those symptoms are accompanied by feelings of urgency. And also sometimes people are having problems with frequency. Most people urinate every 2 to 3 hours, and they're going much more frequently than that. So sometimes I've had patients who are going to the bathroom every 20 to 30 minutes during the day, and sometimes very frequently at night as well.
So what's actually happening when someone starts to lose control of their bladder?
Yeah, urination is pretty simple when everything works right? The kidneys filter the blood to make the urine stored in the bladder. Bladder stretches, you get the urge to go to the bathroom, you find a restroom and go. But lots of things can happen through our lifetime to alter that reflex or our control of it. Things like a broken hip, total hip replacement, simply going through childbirth, menopause, getting older, for women especially, men who have been treated for prostate cancer, people that have Parkinson's disease or multiple sclerosis even. All of those conditions can affect either the neurological component of that urinary reflex or the muscular component, as in the hip fracture or total hip replacement.
So this affects men and women both?
We see primarily women, but yes, men and women both.
So are there specific changes that you can speak to that's going on?
Well, sometimes, as Amy said, there are changes to the neurological system. So perhaps some of the nerves that control urination were damaged during childbirth, or somebody has multiple sclerosis or Parkinson's that affects the nervous system that helps to control urination. There also can be damage or weakness in the muscles themselves, so that they're trying to support everything and hold the urine in, and if they aren't strong, they're not able to do that job, and so people are experiencing leakage.
So I learned a lot about medications that might be effective for something like this, and so what do you recommend that I speak to my doctor about, or how should I go about this if I have this problem?
If you have this problem, the best thing to do is mention it to your doctor first. And if you really don't want to take one more medication, you could ask about a physical therapy referral. And the medications aren't effective for every kind of urinary incontinence as well. So the ones that Wendy spoke to about the damages to the nervous system, those tend to be the ones that the medications work the best for. If it's primarily a muscular problem, then physical therapy may be your best option.
Great. Is there a specific age that someone might fall into this category, or is it ageless?
I would say it's ageless. Most of our patients, though, are probably mid-30s to 60, 70.
Sure.
So, but really ageless. We do see 20-year-olds.
So if I go to my doctor and they say, why don't you try physical therapy? So tell me what you do, or what would I expect to happen?
The first thing that we would do is a patient interview. So we would go through your medical history, any history of births, pelvic trauma, hip trauma, neurological issues. We would also ask you a lot of questions about your fluid intake, so how much you drink during the day, what kind of fluid you drink during the day, even down to what times you drink during the day or you stop drinking during the day. We'd ask about your diet even, because there are some dietary triggers as well that could be a component. We would do parts of a basic physical therapy exam. So if anyone had been for their hip or their back before, we would do kind of similar things, looking at range of motion and strength. There's also a brief internal exam. So what we're looking for with that is muscle strength of the pelvic floor, as well as areas of pain or tenderness. And then a biofeedback exam, which is using a computer to show both you and us as the clinicians what those muscles are doing when you're trying to contract them. Because most people say, I do Kegels. You read about Kegel exercises in Cosmo or whatever. But we find that a lot of men and women just can't find the right muscle to contract. So your body will always substitute what is stronger. So if your pelvic floor is weak, a lot of times your body will just ignore that and go for a bigger, stronger muscle. So you think you're doing the exercise, but you aren't.
Interesting. Interesting. Now you mentioned diet and kind of what their daily routine is. Do you have recommendations just off the top of your head about when folks should, if they're having this experience, of when they should drink or not drink, or how much or how long, and when to stop before bedtime?
When to stop before bedtime is a good one. I generally tell people just sips of water after their supper, or like 6, 7 o'clock at night. During the day, if you're having the issues of frequency and urgency, we tend to be really picky about caffeine.
Oh, really?
Coffee, soda. And as far as recommended water intake, you can find all kinds of recommendations online. We used to say the 8-ounce glasses of water, which I still do occasionally, but what I really try to get people to do is pay attention to what their bodies are doing. So what color is your urine when you go to the bathroom? If it's yellow or dark yellow, you need to drink more water. Preferably water.
Yeah. Well, that's a simple lesson. What about food, diet? Does anything trigger this, or anything we should stay away from or eat less of?
Well, there are a number of things that can be stimulants to the bladder. So again, if you're having problems with urgency, caffeine, as Amy said, is a big trigger. So sometimes I have people coming in and all they're drinking all day long is Diet Coke. That the caffeine and the artificial sweetener sometimes is a stimulant to the bladder. Spicy foods can be a stimulant to the bladder.
That's interesting.
Unfortunately, chocolate has a lot of caffeine in it, so
we'll skip that one.
So again, a little bit is okay. A lot is not okay. Drinking 5 or 6 cups of coffee is not okay. 1 cup in the morning, probably isn't going to make or break. Also, sometimes spicy foods and citrus fruit will be a stimulant to the bladder. In terms of water intake, again, sometimes when people are having this problem, they think, well, if I don't drink, I won't pee. And so they really have severely cut back on their fluid intake. And so it is important that they maintain adequate hydration, because if our urine is too concentrated, that can be a stimulant or a stimulant to the bladder as well.
Interesting. Mm-hmm. So how long of the physical therapy, how long does that last on average?
On average, I would say 4 to 6 visits on average.
Okay.
We usually see people once a week and do the biofeedback, help them to understand which muscle to contract, which ones to relax sometimes. Oftentimes people are trying to contract their pelvic floor and they're not doing very well at that, but they're contracting their abdominals, which are pushing in against the bladder and helping to empty it. And so trying to get them to coordinate those muscles. So we use the biofeedback in clinic, and then we send people home with homework to work on. And generally, like Amy said, 4 to 6 weeks, but sometimes 8. It generally is a little bit longer for men who have had a prostatectomy because it takes longer to get that strength back.
So now that I've gone to that 4 to 6 weeks, what should I be doing after that? What should I expect after the visit with you?
I recommend that people exercise daily. So when we're actively treating somebody, we tend to recommend exercising 3 times a day. But once people have achieved, their goal and they want to maintain, I recommend exercising once a day, every day, knowing that people will probably get 5 days in a week. But it's something that you need to keep up.
Excellent.
Yeah.
Great. Any other take-home messages that you want to inform folks about that would be helpful as they experience urinary incontinence or loss of bladder control?
Yeah, and just to know that, you're not alone. So 14 million, I've even seen a higher statistic, a more recent one that was 17 million, and it's in the billions worldwide. So even though when it is happening to you, you feel like, you're the only person in the world it's happening to, you just have to watch TV to know that you're not, right? With all of the products they're advertising.
Yeah.
So don't be afraid to mention it to your doctor, and don't be afraid to seek help, because it really isn't that difficult.
So see your primary care provider. Don't wait. Don't be embarrassed by it. There's a lot of people experiencing it, and so to speak up and get the help that you need.
Get the help you need.
Yeah, because it can either be corrected or definitely reduced by some simple activites.
Correct.
And a lot of people feel that it's a normal part of aging. They just kind of accept that, okay, here I am. But it's not a normal part of aging, and there is a lot that we can do to try to make those symptoms better.
Well, that's terrific, because I think that's something that you can be embarrassed about and don't want to talk about as we started off our conversation. And so it's a wonderful message to have folks speak up and know that it's not normal. It's not a part of aging. So appreciate that message. So what else are you doing in physical therapy at NMC? What else is going on there? Is this, you deal with more than just this, right? You see other types of patients?
I see a variety of patients. I see the incontinence patients. I also see lymphedema and oncology patients, and then a mix of primarily orthopedic diagnoses, such as hip, knee, low back, neck, shoulders, and occasionally some neurological patients, somebody who's had a stroke or a head injury. So a big mix of people.
Yeah. Great. So you're very well versed.
I think so.
Well, great. Well, you've been wonderful guests today. I really appreciate talking about something that's not so easy for all of us to talk about when it hits us. So a message for all of you, for men and women: if you have urinary incontinence, please talk to your doctor, because there's help, and you can get beyond it. So this is Jill Berry Bowen, your host of NMC Health Beat. Thank you for joining us today.